All right. Good afternoon, everyone. My name is Bill Ikest, and I am past president of the Georgia chapter of HFMA. I want to welcome you to our virtual spring payer forum. We'd love to be together with all of you in person, but unfortunately, that's not in the cards quite yet. Hopefully, we'll get there soon. But for many of you, this might be your first webinar of the week. For others, this may be your third. Today, we welcome Anthem Blue Cross to present to us. Just a couple things I wanted to share with you. I am going to share something on my screen here very quickly. And then we'll switch over to Mary from Anthem. But I wanted to just let you know that there's a lot of good stuff going on at Georgia HFMA. We've got hopefully you all have had an opportunity to attend some webinars during this pandemic. We actually are excited to announce our first in-person meeting. Our Spring Institute is going to be held May 5th through the 7th down at Callaway Gardens. And we're really excited about that. Callaway Gardens was the location for our meeting for many, many years. And we're excited to be back down there. And I would encourage you to go out to the Georgia HFMA website to get some more information and look at the agenda for that event, but it promises to be a great event. We've got a good response and are expecting a good crowd down there. It'll be good to see people face to face. Also, just wanted to let you know that the presentations from this week will be posted on the Georgia HFMA website, and I'll show you at the end of the presentation how to access that. We'll get that information out there to you, but you go to georgiahfma.org, and there's a lot of good information about what's going on with the chapter. I also encourage you to like the LinkedIn page and the Facebook page and the Instagram page and the Twitter page for Georgia HFMA. It's the source of a lot of information. If you're like me, you see some stuff on social media sometimes before you do in your email. And so we want to give you that information and make it available to you as soon as it comes out. So thank you to everybody for their participation this week in putting on the payer forum. Hopefully it's a valuable time for all of you to collaborate with some of the major payers in the state. Certainly, if you have questions as Mary is speaking, please put those in the Q&A section, and we will monitor those for you and make sure that we ask those questions of her. So I want to switch over here real quick to her presentation, and then we will get going. So thanks, everybody. Again, if you've got questions or anything, don't hesitate to ask them through the Q&A as we're going along. So with that being said, I will go ahead and turn it over to Mary Acosta, who's a Provider Experience Senior Manager with Anthem Blue Cross. Mary, we really appreciate your participation today, and thanks to you and your team for agreeing to participate with us.
Well, thank you, Bill, and thank you, everyone, for being here. I look forward to talking to you for just a few minutes. As Bill said, I am one of the Provider Experience Managers at Anthem. And today I'm going to be discussing how our provider experience consultants can help you, how you can submit claims entries and inquiries and self-service tools that are available to the community. So Bill, if you can flip to the agenda, we can take a look at the next slide. Thank you. So there we have it, and AIM, and then show you how to access Georgia Provider News in case you're not already receiving that. All right, Bill, next slide. So I'd like to sort of begin by explaining the roles and responsibilities of our provider experience team within the provider community. Our provider experience consultants are here to meet your needs, and we assist with a broad scope of provider needs, including contract questions, provider training and education on Anthem products, programs and tools, and provider orientation and fee schedule requests. To find the contact information for your provider experience consultant, you can visit our website at anthem.com, select providers, and then select Georgia, then contact us. You'll click on the link that looks very similar to the one on the screen for a provider contact information list, and you should see representatives that are assigned to your area or your county. All right, thank you, Bill. Next slide. I'd like to sort of address some of the way we handle claims inquiries. We aren't able to research claims in provider experience. We have a whole department dedicated to that. So before you reach out to our team with claims inquiries, please visit Availity or contact Anthem customer service. If Availity or customer service can't provide the support you need, we ask that you request a supervisor to help escalate your issue. If a supervisor is not available, they should call back within 2 business days. You would receive a call reference number, which we ask that you keep a note of, and you can always request the call reference number at the beginning of your call. Please note that all claims inquiries must use this process via customer service. Our team is not able to accept claims inquiries that have not followed this process. Next slide. So for the claims escalation and information that's required, if you don't receive the assistance you need when you call customer service and request a supervisor, there are several pieces of information that are required for us to escalate your claims inquiry. We will need a detailed description of the issue, your NPI, TIN, and your provider name, any affected claim numbers, a patient name, date and birth, member ID, date of service, total billed amount, and that customer service reference number. Again, we are not able to accept claim escalations without all of this information. If you have more than 5 claims that you need to have addressed, you can reach out to your provider experience consultant, and we can send you a claims template that you would be able to fill out and return back so we can escalate that to our provider issue resolution team. Thanks, Bill. Next slide. So there are a wide variety of self-service tools that help improve your healthcare experience. Bill, are we on the next slide? Looks like my screen is stuck.
Nope, let me just check here. Hold on. Yeah, it's locked up on me here. Hold on.
Oh, okay. I'll wait. It gets confusing.
We passed this one, right? I think we're down to self-service tools.
Self-service tools, that's correct. But now I'm just, there you go. All right, thank you. All right, perfect. So one of the self-service tools that is readily available to you is the provider maintenance form. And it is an online form that's used to request demographic and practice profile changes for contracted doctors, practitioners, and professional provider records. Some examples of changes that you can report via the PMF include name changes, address changes, opening or closing practice locations, and if you have a provider that's leaving your group. The PMF cannot be used to add new individual providers who require credentialing or any new provider groups that wish to join the network. So to learn more about the credentialing requirements, you can go to our website at anthem.com and look for the application. There's the link is in the presentation, so you'll have that after the call. We do require an advance notice of provider demographic and practice changes. We ask for a minimum of 30-day notice for provider additions and at least 90-day advance notice for any terminations from the network. That gives us time to transition members to participating providers. All right, Bill, next slide.
Hang on for me just a second.
You're fine. So in the provider maintenance form, when you actually go in to fill out the form, and we'll take a look at that in just a second, but you are able to submit attachments like a W-9, copies of licenses, and a provider roster. You will receive an email with a tracking ID. We call it a P number. And that we're able to use that to track where your submission is in the process. So if you reach out to us and say, hey, I haven't heard, has this been completed? We'll ask you for that P number that you should receive in an email confirmation when you submit your provider maintenance form. So make sure you keep note of that. All right, next slide.
Yep, it's being a little temperamental. Keep trying here.
That's fine. I am not in a hurry.
How about that one?
Perfect. So you are able to use the provider maintenance form to make changes to an individual provider record or an organizational record. So you would select individual to make changes to a person's update, like the language that they speak or the days that you work, specialty, license, that sort of thing. You would select organization if you are making updates to 5 or more providers, and you would attach the PMF organizational spreadsheet. So, thank you. Some changes you can make to an individual provider record are listed there on the screen. Please note that the submission of additional documents or information may be or is required for any licensure or certification updates, provider specialty updates, tax ID changes, and provider name changes or updates. And those, remember, you can attach in your submission. The change submissions are always a request for action, and many of these actions can be made without any sort of approval or review by the provider experience team. However, some may require some additional details, documents, or process. One of the provider representatives will always reach out to you by email or phone if additional documentation is needed, or if there's some clarification needed. Please make sure you refer to your provider agreement for terms of termination. Okay, next. Thank you. Okay, so Anthem requires an advance notice of at least 30 days for an effective date, as I said before. Providing that advance notice of a change will help us ensure a timely update. For all hospital-based providers, effective dates will be the same as the date of the PMS submission. So for example, if you go in and submit a request to add a hospital-based provider today, the effective date of that will be actually today. We do not offer retroeffective dates. So please make sure that you aren't submitting for retroeffective dates, because this may result in a delay or rejection of the process. All changes made on the form will apply to the individual person entered or the location entered to the organization's name. Thank you. All right, once you've selected the fields that you wish to update, you'll enter the specific details for each of those fields. When adding a new detail, you can click on the plus field to add any additional fields and update those as needed. Thank you. So many selections offer a quick search function in a drop-down choice. You can start typing to narrow the search. Some fields will auto-populate with the information to ensure accuracy. So like once you've put in your identifying information, your address, that sort of thing, that sort of will pre-populate throughout the form to sort of try and make it a little bit easier so you don't have to keep selecting information. Okay. You'll attach any necessary documentation to support your request. So for example, a W-9 for PIN change or a name change, copy of your updated license for a name change, that sort of thing. There is an attachment limit of 10 MBs, but you can add a zip file to decrease the size if necessary. And once you have completed all the necessary fields, you can review your submission to ensure accuracy. It normally is all right there for you. You can print the page, by clicking on that print icon at the top. And if you find that you need to edit, if you've added some information incorrectly, you can use the little pencil icon, click on that, and you'll be able to edit. Once you've done that, you've verified that the information you are submitting is correct, you will need to attest. So you'll go in and validate that the entries are true and correct. You'll check the box and then select the submit button. And then once you submit, you'll get an email with the change request reference number that we talked about before. That's that P number, and you see that right in the middle of your screen. It says P783 for this example, but that will be sent to the email address that was put in the actual provider maintenance form in the contact information when you start filling out the form. So keep a note of that, so in case you need to refer back to it, you'll have it for easy reference. And then you'll get the email. It looks very much like this with your P number. It will give you an asterisk, and the changes that you've requested will appear there on the actual email. We do have some changes coming up where you'll actually get part of the NPI and tax ID that you've actually requested. That's been something that has been requested in the past, because if you forget what you've submitted, or if you submit several of these at once, it can get confusing as to who belongs to which P number. So that's coming, that should be coming out soon, hopefully. All right, Bill, thank you. Next slide. And then some easy, gentle reminders about the, oh, yeah, we're still.
Oh, no, you're fine. Hold on just for me just a second.
You're fine.
Okay.
Perfect. So just a few reminders. The PMF cannot be used to add new individual providers who require credentialing. You would need to submit an application for that, and you can do that at anthem.com. If you've got 5 or more providers, you can submit all of those updates on one spreadsheet, so you're not having to fill out individual PMFs for each provider. That should make it easy. You know, if your group is adding a location for all of your providers, you can put all of that on one spreadsheet and send that in. Makes that a little bit easier for you. We do require an advance notice of at least 30 days for an effective date. So again, and there are no retroeffective dates. Any hospital-based providers, your effective date will be the same as the day you submit your PMF, or if the provider license date for new providers. Don't forget to attest to validate your entries, and then make sure you hang on to your email with your P number for your record. Thank you, Bill. Next slide.
Yep. Well,
Am I just being impatient?
No, it's just as one will go and doesn't go. There we go. I think that's where we are.
That's perfect. Thank you so much. So to access the provider maintenance form, you can visit anthem.com, and you would click on providers. There you'll click on provider maintenance, which would take you to the online form. So it's fairly straightforward and simple to get to. All right. Next slide. Our next tool for a self-service tool is the digital provider enrollment. So if you do have providers that need to be contracted or credentialed, you would use the digital provider enrollment. It's one of our newer tools, and it is located on the Availity portal. So the tool is created for professional providers whose organizations don't have a delegated credentialing agreement with Anthem. Providers who submit today via roster or have delegated agreements would continue to use the process that they have. You would not use this digital provider enrollment. And that would be the same for delegated providers would not use the PMF. You would use your delegated process that you use today. But for this digital provider enrollment, you can add providers that require credentialing to an existing group, or you can apply and request a contract.
Mary, I've had a couple questions
Okay.
come in. Can we take a pause to address a couple of those?
Sure.
So, so the first one is, and this is about COVID claims. I don't know that you've mentioned COVID yet in your presentation. That's obviously been top of mind for a lot of folks, so I want to make sure that we get these in. So the question is, Blue Cross seems to still be rejecting lots of new COVID ICD-10 diagnosis codes that were effective 1/1 of 21. Why is that? Is Blue Cross not updated with those diagnosis codes? Can you respond to that at all, or and then I have another
all I
question.
can say is I would probably need some specific examples, and you are certainly welcome to reach out. I know we've had some questions around COVID codes and the ICD-9 code, you know, why the codes are rejecting. So we don't have access to see individual claims, but we certainly can escalate those up for your specific example. So if, Bill, you're welcome to share my email address.
Okay.
I'll be happy to connect you with your consultant, and we can work through those with you.
All right, I'll get that. I'll make that available. Next question is
Thanks,
denials.
that's a great question.
Yeah, denials for
Mhm.
denials for NDC number on claims. We've verified the correct NDC number is being used, but we continue to receive denials from Blue Cross. What NDC numbers are loaded in the Blue Cross system? Do you have a list of the NDC numbers that is loaded that they would reference or would be able to match up? There seems to be some inconsistency there.
Yeah, so there is, I do know that they update that list quarterly, and I do know there's been some delay in getting the latest updated. Bill, if you can share an email address of the person that asked that question, or I can share a link with you where they can go out and see where that NDC information is located, I'll be happy to get that information out.
Okay, and she says she'll get that information to you, so.
Perfect, thank you.
Let me check one other thing. Yeah, we've got a couple people that have responded with the NDC issues. So I'll make your,
Yeah.
Is your information on the last slide, do you know, by chance, or maybe not?
Probably not, but I'll be happy to give that out.
I always tell people that if you're willing to give your email address, that they also have to send you a holiday card to just to share the love. If they're going to ask you for information, they've got to include you on their Christmas card list.
You know what?
Yeah.
I'm not even going to require that. You know,
Okay.
I'm here to help. You know, I can't answer a lot, but I surely can get you to where you need to be.
I'm sure.
And make sure you get your answer to your question. So,
it looks
but a
like
card would be nice as well.
Yeah, absolutely. It looks like it looks like for some of them, the NDC issues are for claims prior to November, actually, of the 2019 implementation date. So.
Right. So we had received that question beforehand, and I've actually already reached out, waiting for an answer on that one. So I'll be happy, Bill. I don't know if you'll have the contact information for the folks that ask those questions, but I will respond to you directly. Now,
one person indicates that they're not getting they've reached out to their provider rep for some of these issues and are not getting timely responses back by either phone calls or emails. Is there an escalation process that they might go through?
You can contact me.
Okay. Okay.
You can
Be
contact
ready.
me, and we will. Yeah, we will. Well, I get them already. So we are in the middle of a transition, and are working to fill some vacancies. So we've had a couple challenges, and are trying to work through those. So, but certainly we should be responding timely. So if you can send that information to me, we will make sure to get your questions answered and get the information back to you. Mm-hmm.
Yeah, let's go ahead with your presentation, and I'll come back to some of these when we get back to the question and answers.
All right, perfect. All right, so
Whoops.
Oh, so yeah, back to digital provider enrollment. So I was just going to say, to access this, you log in through Availity. If you're not currently registered for the Availity portal, whoever in your organization is designated as the administrator would go and get you registered. For those of you who are already using Availity, your administrator would go to the dashboard to register any new users and update or unlock any accounts for existing users. So, and just so you guys know that the credentialing and enrollment process takes about 120 days. So if you've not received information back in 30 days, don't fret. That process of credentialing enrollment takes about 120 days. So, and we also ask that providers do not render service to members until they're notified that the credentialing has been approved and that their agreement is executed and they've been added. Thanks, Bill. Next.
Hang on.
All right. And speaking of Availity, some of the self-service tools that are available there are eligibility verification. You can check appeal status using the ICR. You can check claim status. There's a remittance viewer, and the newest of the Availity features is the provider chat. There were some challenges with that early on. I believe they've gotten the majority of those worked out. So we are definitely encouraging providers to use the chat feature. That, you know, saves you from having to call and be put on hold and all of that. Next slide. And just so you can see, once you've logged into Availity and you've gone through the payer spaces, you've selected Anthem, the chat with payer, there you see the red arrow there, is you would click on that, and then there's a pre-chat form that will ask you for some specific information about your practice and your member, and then you'll start your chat experience.
Mary, this has been a question in the past, and it may or may not be relevant still today, but a lot of times what happens is, you know, there are a lot of places in Georgia that have a lot of people passing through, either traveling to other places or coming to Georgia from other places, and they may have a Blue Cross plan that's not part of the Georgia plan, so a lot of times Georgia providers are having to inquire on claim status about a claim that's with a home plan outside of the state of Georgia, and there's been people say that when they inquire about claims that are with a Georgia plan, they're oftentimes able to get a lot more information than when they inquire about a claim from a plan outside of Georgia. Do you happen to know, has Availity expanded the amount of information that the hospitals are able to see or get regarding claim status if it's on a plan that might not be from the state of Georgia?
No. At this time, providers are encouraged to call the actual number that's on the member's card for those that are out of state. I don't know if that's something that's coming. I've made a note of it, and I'm going to double check because I think I've heard that as well, and I think that would be super helpful. But because of, you know, I don't know how feasible that is, but I certainly think it would surely make everyone's life easier.
Yeah. Trust me, that's what we all want, hopefully. So.
That's a great question. Yeah, that's a great question. All right. So providers are able to check the clinical appeal status with the ICR or the interactive care reviewer. Remember, you have to start the appeal online to use the feature. To access the ICR, you could log into Availity, select patient registration, and then authorizations and referrals. In the menu bar, you would choose check appeal status and then type in your case ID using all characters, including the dashes. And then you enter your member ID. And you can check those appeal status there. Okay, and another tool is the Clear Claim Connection, and I always get tongue-tied when I say that. It is a tool for evaluating clinical coding information it provides information according to the claim editing system logic on the date of the inquiry. So you would just basically put in the codes and the information that it asks for you. You do have to review and accept terms and conditions of use prior to reviewing data. But as you see there, it's right there. Once you've gone into pair spaces, you should have that little heart with a clear claim connection. I said that twice and didn't get caught up on it. That's amazing. All right. I always get stuck on that. And then for help and training, I go out here an awful lot in, if you do the find help and payer help, there are all sorts of resources and training out here available for the provider community. You can request support. You can open a support ticket if you're having issues with availability, you're having issues seeing things, getting the support you need. You can open a support ticket. If you've not been out here to the help and training on the availability site, I can't recommend it enough. It really does have a wealth of knowledge and help available to you. All right.
Mary had a question. Had a question about that. It
Sure.
appears that claims and medical records are not getting matched up in availability necessarily all the time, and some providers are having to call or use availability chat to get them matched up. In the system, you would expect the system to match those up automatically. Have you heard any issues about that, or do you have any suggestions on what that might be about?
I knew there was an issue with that previously. I've not heard anything lately. So is that a new issue?
I'll wait to see what she said. She says it's not a new issue. So can she reach out to you maybe with some specifics on this as well?
She can. There are also some resources out here for attaching itemized bills and medical records that I'll be happy to share with. But yeah, we can. I can certainly help with that.
Okay. Great. Go ahead. We have some others, but I think you're getting close to, and we'll have some.
Yeah, we're right at the end. So again, the help and training is amazing. So try that out if you've not been out there. Like I said, there are all sorts of resources out there. I didn't even realize all that was out there. So it's good information to have. All right. And then our next topic is AIM. And I know this will be a hot one.
Yep.
AIM is the specialty benefits company that supports Anthem in managing the radiology, cardiology, sleep, radiation oncology, MSK, the genetic testing and cancer treatment pathways. You can contact AIM, and I know that this has been a sore spot for a good part of the year. You can flip to the next slide, Bill. If you log into the provider portal, or you can certainly give them a call. We skipped a slide, but that's fine. You can go back. Can you go back? Yeah, there it is. Okay. With the AIM support number on there. And I know that there have been some issues around AIM, providers being able to get through and that sort of thing, and just know that they are working on it. It has improved substantially in the last 2 months. So we hope that stays on that path to better. For provider news, we do provide an update, sort of a provider newsletter. You can get that delivered straight to your inbox. The link will be right here. You can go out to anthem.com and then providers and then subscribe. You'll get that right in your inbox. It is chock full of information. You can flip to the next slide, Bill. All of the policies and programs, any changes that we have, claim filing, any admin updates, new procedures and guidelines, pharmacy information, all kinds of stuff. You can get there at providernews.anthem.com/Georgia. All of the newsletters are out there, so you can see them, as far back as they go, which is a lot. So, and like I say, I would strongly encourage you to sign up to have those delivered to you. You'll get them on the first of the month when they come out, and they are full of helpful information. And that's all I have. I'm happy to take questions.
Yep. Let me.
Yes,
we have a few more that have come in. So yeah, I think you might get a few emails from some people. So, one of the things that we tried, one of the things that we hear comes up at these payer forums pretty consistently. We generally host them twice a year, and in a perfect world, the provider reaches out to check on a claim and they get the answer that they're looking for. But a lot of times there's either a disconnect between the information the hospital has and the information that they're getting from the payer. So we're trying to make sure that those that line of communication is working like it's supposed to. I know you guys obviously want that as well. So that's one of the things that we hear come up a little bit. Let me go back to that. We actually had some things come in through the chat that I was just asking for feedback from folks. There does seem to be a concern from a couple of the attendees about just very long phone calls. Supervisors are not available or disconnected when asking for a supervisor. Supervisors do not return calls. Thoughts on that? Again, it obviously would be important to direct people as much as they can to the online portals, but they get a reference number, don't they, typically? But if they're having an issue with calls not being returned, especially when they've escalated those calls to a supervisor level, what would your recommendation be?
Right. So thank you for that. If that's the case, we need to know about it because that is the process. So if that's not happening and you've got your call reference number, go ahead and reach out to your consultant and let them know, hey, I've reached out, they've not called me back. Here's my reference number, and we can go ahead and escalate that up for you.
Are all of those contacts for the hospitals, all of those provider reps positions filled right now in Georgia, or are there some vacancies or maybe changes that people might not be aware of?
There have been a few changes, and I can't promise you that there won't be some more, but the list is updated as of today that's out there is updated with the correct contract or the correct consultant information. So you certainly can send that out. We are working on getting, like I said, we are in the middle of transitioning and doing some things to work smarter and not harder, and to help our providers make this a good experience and improve relationships and that sort of thing. So we appreciate your assistance and in reaching out and following the guidelines. And when they don't work, to reach out to us and say, hey, this isn't working. So we appreciate that. And your patience is really appreciated. So we're really working hard. I promise we are. And I look forward to helping you all and making this better.
Yeah. Here's one from somebody, and that says that the question is, my company has a contract with Anthem for timely filing at 180 days. We've submitted claims over and over again and getting them denied for 90 days timely filing. However, since our contract is not the same as others, how can we get this rectified? We've talked to multiple people within Anthem and still there's no resolution. Who can she talk to? Can you direct her? Can she start with you?
She can. Yes, absolutely. I'm not going to be able to. Absolutely. That's my job, is to get you to where you need to be. So yes, please reach out to me directly and I will get you to where you need to go. Yeah.
Because I know, just like anything else, from your perspective, you're hoping that things are running as they are intended to, but if there are issues, obviously you want to know about that and be able to pass that information along. So,
of course, yeah, of course.
Here's another one which it says we've escalated several accounts with call reference numbers where we've requested a supervisor and the rep denied our request? Has there been additional education to the customer service reps informing them that they cannot deny the request for a supervisor? So it seems like that would be a surprising response from somebody, that they wouldn't be able to speak with a supervisor. So thoughts on that?
I agree. And if you find that that is the case, we need to know about it. But that was a fantastic question. And the answer to that question is yes. We had heard that previously. I've not heard it lately. So if that's something that's persisting, certainly let us know, but they have been informed and educated on the customer service side. So
Yeah.
Thank you for that question.
Yeah. Here's another one. There seems to be a disconnect between AIM and Anthem. When we call AIM to obtain an authorization number, we're told one is not needed, but then our claim denies for lack of authorization. We've escalated these issues with copies of call transcripts to have the claim still deny. What steps is Anthem taking to resolve this issue? Is this anything that you're familiar with or that you've heard about?
No, I'm not. There have been some cases here and there. I've not heard anything around that in probably since maybe February. So if that is something, again, that is persisting, certainly let me know. And, you know, we can take that up.
Okay.
That shouldn't be something that's still happening.
Right. So I've put Mary's contact information in the chat for the attendees. And Mary, I can tell you, I'm familiar with a lot of the names of the people on this call today. They're great folks, and they're obviously trying to do right by their organization, and they might be a little frustrated. So, but I would suspect that they'll likely reach out to you, and if you can help, obviously direct them to the appropriate people. Some of the issues that you might hear about are consistent, right? It's not just a single facility or whatever. So yeah, any cooperation, collaboration you can give them to help with that would be greatly appreciated. Some of these folks have been doing this a long time, and
right.
and certainly know more about it than I do, and you know, get frustrated when they have to deal with some of the same issues. Again, it's not just Anthem, but with other payers have to deal with some of the same issues over and over. So
of course.
Yeah, so listen out for these folks, and whether you talk to them or communicate with them through email, just know their intentions are good. They might be a little fired up because they've been fighting this battle maybe for a while, but
that's okay. I understand.
Yeah, it's all good. So let me see here. I think I had, let's see if we got one. Yeah, that NDC number issue seems to be one that a lot of them are experiencing. So, and again, obviously if a list or something's available for that, let's see. I had someone ask where they can get a copy of today's recording, and I am going to pull away from your presentation and pull up another page that I can share with the group. Let me just get to that real quick, because we do want to make this available to you. And I understand why you didn't want to turn your camera on. You know, some of these people might, if they see your face, they might run into you at a Braves game or something and stop you and ask you some questions about claims, and you certainly don't want that.
You know, I would have, had I realized. I surely would have. My computer's actually on a docking station, so I would have had to do some manipulating, but I would have. Hey, for the next one, I gotcha.
There you go. It's all good. Here we go. So hopefully folks can see this now. So this is the Georgia HFMA chapter site. And when you go to the main page, you'll see over here is media. Go down to the document library, and there's a section over on the left called In Case You Missed It. Double click on that In Case You Missed It folder. There's a 2021 folder. There's a virtual payer form folder. And then there will be the presentations. I'll get Anthems over to be posted a little bit later on this week. And there's also a link to the playlist, which is a recording of today's call. But the presentations, the PowerPoints, probably in PDF form, will be there, and that's how you access that. The other thing I wanted to point out again, and I kind of alluded to this at the start, but I just wanted to thank the corporate sponsors for the Georgia chapter who have really kept things going this past year, along with the chapter leadership. I want to thank Lawrence Harris and all of his team for a most unusual year. A lot of the leadership team for the Georgia chapter are folks that have been involved in healthcare in Georgia for many, many years, and they really have been great in leading us through what's been an otherwise challenging year. So, and I want to be among the first to welcome Elizabeth Richards as she comes in later on in May as the chapter president for 2021-2022. So thank you to all of our corporate sponsors. And let me see if I had one more come in here, one more question. Let's see. I don't think so. Yeah, no, I think we've covered everything that everything that's been thrown out there. So yeah, look, check your email, obviously, Mary, and we would appreciate it. And we'll
absolutely.
Yeah, we'll hope. But did you have anything else you wanted to leave with the group before we sign off?
No, I don't think so. I just thank you all so much for your time today and for listening. We took it back to basics, tried to keep this short and sweet. I knew you'd have a lot of questions. I didn't realize the NDC thing was going to be the question of the day. So yeah, thanks to those of you who've asked that question. I always appreciate learning new things. So
yeah,
thank you
absolutely.
so very much. And I'm sure that Bill will share your information and all with me, so I can, any of you who are just waiting on a response back regarding NDC, I will reach out to you directly and let you know what's going on with that.
Yeah, yeah.
So thank you so much.
Right, and I think the thing I would leave with the group, the folks on the call, is as we've seen from the payers so far this week, there are a lot of online resources available to them to hopefully fast track some of their issues perhaps, or give them information that they would otherwise maybe expect to get from talking to someone live. So make sure you're utilizing those resources, get comfortable with those resources so that you know what information is available to you out there. For those of you on the front lines, you know, first and foremost, thank you. And I would tell you that continue to do the work you're doing and believe in your ability to do it, and believe that you're doing the right thing for your organization. Everything will be okay. I like to think that each day we're a little bit better than we were the day before in getting back to where we want to be. So hang in there. I don't see any other questions coming in, so I think we will sign off for today. Tomorrow we have United Healthcare scheduled from 1 to 2. And I hope that you'll dial back in and join us for that session. But in the meantime, stay well. Thanks for supporting Georgia HFMA, and we'll talk to you soon. Thanks again, Mary.
Thank you. Thank you all. Have a great rest of the day.
Yeah. Thanks, Elizabeth. You're going to go ahead and stop recording, I guess. Thank you.
Yep.